not all women even understand or are aware they are going through menopause because not all symptoms are the same.
Okay, let's go.
Hello, everyone. Welcome to the final episode of our series on mental health and menopause on Coaching to Change with me, Dr. Bryant. So in this episode, we are going to discuss, and I say we this time, not me, because the feedback I've been receiving has been incredible. So we're going to focus on something that's quite important and definitely falls under the skill sets that I have been discussing my entire coaching and psychological career. And that's to focus on the mental health risks that many women face during menopause, is specifically to discuss depression, anxiety, and sometimes, unfortunately, suicidal thoughts. Understanding and managing these risks can help women navigate this challenging phase more effectively. You see, menopause is often thought of as a time of physical change, but the mental and emotional toll can be just as significant. Many women experience symptoms such as I mentioned earlier, depression, anxiety, irritability, and even feelings of hopelessness during this transition. These mental health challenges, they're not a sign of weakness. You have to understand they are a natural response to the hormonal and emotional changes occurring in the body. I recently watched an episode of Oprah Winfrey, and I've actually followed Halle Berry in discussing this. And it was quite enlightening to understand that the research that I have done literally coincides with what they talked about, because women have come to a point where they are confused. And the scary part is that doctors have been misdiagnosing women, thinking that it's something else outside of what it is, menopause. So the hidden struggles is really what is causing women through their frustration, the depression, and the anxiety. So I want to kind of touch on that, because while menopause itself does not directly cause depression or anxiety, it is the hormonal changes that accompany it that causes that trigger. And again, there's that word that I talked about 1,000 times regarding mental health, or exacerbate existing mental health conditions. So let me elaborate on that again, because there are many women who already currently have certain mental health issues or challenges. So can you imagine how going through menopause may tap into that and literally elevate it to a level that they may fear? The decline in estrogen, it affects the brain chemistry, leading to mood swings, irritability, and feelings of sadness and or hopelessness. And that is where we need to be very careful. Many women report feeling isolated, misunderstood, or even ashamed of their emotional struggles during menopause. And again, keep in mind, not all women even understand or are aware they are going through menopause because not all symptoms are the same, and not all women approach it at certain ages that they may commonly think. And based on research, there is premenopause, therefore having certain signs of this way before they may feel that they should. So this stigma can prevent them from seeking help and receiving the needed support. It is essential to recognize that experiencing emotional difficulties during menopause, even if you're not sure, it is normal. And women deserve to seek treatment and support without fear of judgment. So if a woman should find herself in a deep depression, experiencing suicidal thoughts, it is very important to reach out for support. One of the most alarming risks during menopause is the increased vulnerability to suicidal thoughts. While menopause does not directly cause suicide, the combination of emotional distress, feelings of loss, and societal pressures can make some women more susceptible to these thoughts. It is essential to be aware of the warning signs and seek help if needed. I can only imagine somebody suffering from work, feeling they're not being a good parent, not being a good wife, and again, tapping into current mental health challenges. This is definitely going to elevate their concerns. So if you or someone you know is struggling with thoughts of suicide, it is critical to seek professional help immediately. Therapy, medication, and support groups can provide valuable resources for women and men who are experiencing mental health challenges. And relating to menopause, women can definitely seek assistance. In conclusions, I want everybody to understand that help is available. Navigating the mental health risks of menopause, specifically regarding this particular podcast, is difficult, but it is possible to manage with the proper support. Therapy, mindfulness practices, exercise, and medication can help women regain balance and well-being. And if you are struggling with your mental health during menopause, do not hesitate to seek support from a therapist or healthcare provider. My name is Dr. Bryant. I am here on this podcast providing insight based on research, based on reading, based on education. So I hope you find this information valuable. Please share with others who may need this type of data. We hope you found this series on mental health and menopause helpful. Share with everybody who may benefit, and do not forget to subscribe for more insights on personal growth and well-being regarding mental health. Remember, you are not alone, and there is always help available.